Hi friends, it's Dr. Russ. Welcome to this video that I'm calling, How Do I Find a Good Chiropractor? I'm making this video because that is by far the #1 question that I get from people in the comments and who reach out to me via the contact link, which is in the description of every video. Dr. Russ, is there someone in my town who does what you do? Dr. Russ, can you tell me how to find someone who does what you do? It's very flattering, really. Thank you. I find that awesome, and I always try to help. So I'm going to tell you what I do, and then maybe you can do it for yourself, or you can reach out to me and I'll do it with you and for you. I really want everyone to find the care that they need. So how do I find a good chiropractor? Well, first, I hope you ask your friends and family. And if you haven't thought of that, try that first. Personal knowledge and firsthand knowledge is always the best information. But let's say your friends and family aren't into that or don't know, or I don't know. So we go to Google because Google is our friend. So let's talk about what to Google and what to look for in your search results, how to assess what a website is, and kind of tells you what you need to know about the chiropractor or physical therapist, massage therapist. Once you get into the office, what to look for, what kind of experience will give you the sense that you're going to have the results and the kind of attention and treatment that you need. And then we'll talk about red flags at the end. Okay, so Google and Google reviews. These are the search terms that I use when I Google for folks. Myofascial release, chiropractor, whatever pain or injury you're dealing with, say TMJ or shoulder pain, craniosacral or cranial work. So this, if a person has these on their website and they are legitimately doing these things, then they're probably going to be pretty good. Not necessarily, but that's a really good start. And then once I get to my list of links, here is what I look for. #1, is the website original or is it sort of a generic website? There's nothing wrong with a generic website or inherently better about an original website. It just, if it's generic, then I don't really know that it's giving me a sense of who this person is and what this practice is like. So when I first started with my own practice 15 years ago, I had a pretty generic website with the company iMatrix. So these three are the three big companies who do web stuff for chiropractors. I am not throwing shade on these companies. They're doing good work, providing technological help for chiropractors and PTs and acupuncturists and everything. So if you scroll down to the bottom of someone's website and you see one of these three companies, you know that probably what's on that webpage was not written by that chiropractor. Certainly the design was not by them or their office staff. So that's just a piece of information. Whereas if it's original, like I designed my own website, I wrote every word of copy on my website. I want it to be a reflection of me so that when people are looking for me and looking at me on the internet, they get a sense of who I am and they can make a better decision about whether I'm going to be a good fit for them. Because I really love it when people come in and it's immediately obviously a good fit. And it's not so great when someone comes in, it's a little awkward, like, oh, I didn't know you weren't going to just crack my back and kick me out. And some people want that. I don't do that. So another thing I look at is sponsored links versus organic hits. So an organic hit is not a reference to smoking weed. It's about when you type in a search term, Google matches that website to you purely based on those keywords and not because the person paid to have their website elevated. That's a sponsored link. So when you look at your Google results, the first, I don't know, 5 or 10 results usually say sponsored or ad. That person paid to have their listing floated up to the very top. It irks me a little bit that even if you Google my name, Chiropractor Portland, I'm not the first hit. There'll be like 10 sponsored links first. That bothers me a little bit, but what are you going to do? That's Google. I prefer to skip the sponsored links and go straight to the organic hits because the organic hits are there because that's a website that is updated more frequently. That is a website that has more links to it. And so it's more of an integral part of the community of people doing this stuff on the internet. My website gets elevated on Google because of my YouTube channel. That's a really wonderful, nice little side effect. And by the way, thank you for watching this video. And if you're a channel member, thank you. I really appreciate it. The other thing I look for is a flashy website versus a more understated website. That's more a personal preference. Some people like flashy. I don't. I like understated. If you look at my website, happyspinepdx.com, like that's my vibe. Yes, there's video, one of them auto plays, but it's not flashy. It's very informative. And that's another important thing to me. Is there a hard sell happening on this website? One of the clues to a hard sell is they're going to ask for your email address up front. So you get to a website, we've all seen this, you're browsing and within 10 seconds, something pops up and it's in your way and it says, hey, do you want to download our free 30-page PDF about carpal tunnel syndrome or whatever it is? Sure, yeah, well, just give us your email address and we'll email it to you. Seems great, right? Free. But it's not free. You're giving them your email address, and in doing so, you're opting into their email communications. Sure, you can unsubscribe later. Not everyone honors unsubscribes, but the point is they want your email address so that they can market to you. They know that you came to their website looking for carpal tunnel syndrome, so now they can send you carpal tunnel related marketing emails. That's more of a hard sell website versus informative, where here's information about this condition. Here's how we treat it. I'm here with this information on my website to help you make an informed decision about your health and your life. That's my intention. That's my goal. And those are the people I want to work with as a patient when I need healthcare. Anytime there's a promise or a guarantee on a website, I scroll away. And I also am wary of deep discounts on the first visit. So I say this as a person who has a sliding scale and is willing to work with folks who can't pay the whole fee. Like I'm not going to turn someone away because of a financial reason. On the other hand, I don't widely advertise a $29 first visit, including x-rays. And a lot of times when you see that, they just want to get you in, they want to get your information, and they want to try to sell you a treatment plan. And that's a problem in the chiropractic profession. There's a lot of hard sell going on. There's a lot of fear-based sales going on. There's a lot of over-treatment going on. I don't like it. I don't like that it's part of my profession, and I certainly don't want that as a patient. If you're still watching me 8 minutes in, you probably don't want it for you either. So trying to avoid getting into those situations where you have to kind of hold firm and say, no, I'm not signing this and giving you $4,000 today for a treatment plan that we haven't tried yet. So once you have found some possibilities, look at their Google reviews. And Google reviews are wonderful because it's mostly real people leaving a review. They were really, really happy or they were really, really unhappy. And as a provider, as a business owner, I cannot remove negative reviews from my review page. I do not have that power. If I think something is unfair, I can appeal to Google about it and they'll look at it and make a decision, but I have to live and abide by that decision. I can respond, and I'm encouraged by Google to respond to my reviews. They tell me that by engaging with reviewers, it lifts my search engine standing. So I do that. But just be aware that it is possible to pay for Google reviews. I get spam about this all the time. People wanting me to pay them just really a few $100s, and they'll deliver dozens and dozens of really, good reviews on Google or Yelp from real looking people with profile pictures and everything. So just be aware Google reviews can be fake. So let's say you found someone on Google that you think might be good and you want to make an appointment and you're going to go in. Well, the experience of making the appointment is always kind of telling. Does it take 3 weeks for this person to get back to you? Is the office staff friendly? Is it a kind of an easy thing for you to make that appointment? That's what I'm looking for. Someone who's got their systems at least a little bit dialed in, because I don't want to get fallen between the cracks and kind of getting caught in someone's inefficient systems. I don't know if you've realized this about me watching my channel, but I'm kind of a tidy person and I like it when things work the way they're supposed to. So what's it like to make the appointment? And then you go in and hopefully the provider sits down with you and asks you the question, why are you here? What can I do for you? And you want someone who will listen to you closely and think about you as a unique person with unique needs, because we all are unique and we bring our own story and our story is important to us. Does this person communicate well? Particularly, do they listen closely? Are they distracted while you're talking to them, or are they really just focused on you? Do they ask questions? Are they relevant questions or irrelevant questions? And finally, do they interrupt you? Getting interrupted by a provider when I'm in the middle of telling them why I'm there, I find that kind of annoying. Um, Sometimes it's necessary as a provider to interrupt because people can ramble. They've been thinking about their problem. Maybe they've been waiting for this appointment for weeks. Maybe they've been thinking about making this appointment for years. And finally, they're there and they got a lot they want to say. And of course, I want to hear it. I think it's important for people's ability to be present for the treatment is to say whatever they need to say. But on the other hand, we only have so much time. And sometimes it is necessary to ask them to pause and let's focus. But that's not the same as repeatedly interrupting, not letting me finish my sentence when I'm answering the question that you asked. I'm a little, I'm a little pet peeve about that because that just happened to me the other day. So then we move to the intake and the exam, and we want it to be focused. It's a chiropractic visit. Are they checking out your toenails, like irrelevant stuff? Or are they focused on the problem? But is it thorough? Is it like cursory, perfunctory glancing? Or is it like, let's really look at this and really take our time to feel this? To me, a spinal exam takes at least 10 or 15 minutes because yes, I'm going to look. That only takes 20 seconds. I'm going to ask you to move through your ranges of motion. Let's say that's a minute generously. So we're now at a minute and a half, but the next 10 minutes or so, you're going to be laying down. I'm going to feel every vertebra and all through the muscle layers. Like that's what you need to do to really get a sense of what's going on in someone's spine. And if it's a hip, it's the same thing. You got to feel, you got to look. It takes time. It should be thorough and focused. And along those lines, they should present you with a plan for treatment, which may just be one visit. Sometimes my treatment plan to the patient is, I'm going to adjust your sacrum and it's probably going to make you feel better. And then I'm going to let you go back to your normal activity. And if it comes back, call me. Or maybe it's 3 visits. Like, let's work this out a little bit. Let's try this once a week for 3 weeks. And sometimes it's obvious that a person is going to need to be seen more than that or longer than that, but it should always be individualized. And your response should be monitored and the treatment plan adjusted accordingly. Too often, people come up with a great treatment plan. It makes a lot of sense. It's appropriate for the diagnosis, but for whatever reason, the patient's not responding positively, favorably. In that case, you got to change a treatment plan. Too many doctors, not just chiropractors, but many types of doctors just say, well, let's just give it more time. Well, but doctor, I'm actually getting worse. Well, sometimes you got to get worse before you get better without really investigating what's going on. If a person's not getting better, you need to investigate that and change the treatment plan. Or maybe your conclusion really is, well, we just need to give this more time. But a lot of times that's just said to keep people quiet and not complaining. And so they'll come back. I'm sorry to say it, but it's true. If it's not obvious, I'm not super duper comfortable with other chiropractors. I am a chiropractor and I love my job. I love my practice. I love my patients. I love what I do, but I'm much more comfortable in the company of acupuncturists, naturopaths, physical therapists, massage therapists. I think that's personality wise. And I think that's got also to do with my practice style. So if a chiropractor or any provider really has a complex treatment plan, multiple visits, weeks or months, expensive, and it's ready for you within minutes of you having your exam, red flag number 1. That is a standardized treatment plan that they give to everybody, and that is not suited necessarily to you and what you came in for. So you do not have to sign anything. You can always say, I'll think about it. If they're asking you for an upfront payment, that's a red flag. No, we pay as we go. Sometimes people do like to prepay for a package of appointments, but these are folks who are already established as patients and know they're going to come in every 3 weeks to help them with their headaches or whatever it might be. And I'll say to those people, well, instead of this much per visit, you can pay 20% less by buying a pack of 5. And they're like, great, let's do that. But that's really different than first visit or second visit. you come in and they say, here's your treatment plan. It's $4,000. We want you to pay for it up front, because they always say, well, that's how you get compliance. If people don't pay up front, they trail off and then they don't get the results, and then it reflects poorly on us as an office. I call bullshit. If they're getting good results, they're going to come back until they don't need you anymore. And if they've committed to 30 visits but only need 10, what are the other 20 visits for? You're providing treatment at risk to the patient and cost to the patient that's unnecessary. That's unethical. If your questions and concerns are not taken seriously and addressed, that is a red flag, not good. If you are made to feel afraid of your condition, and that you must act immediately or dire consequences will ensue, that's a high pressure sales tactic appealing to your fear, and you should not stick around there. If you are pressured to purchase supplements, specific supplements from them, like this is the best vitamin C, no vitamin C is as good as this because it has some phytonectar or whatever. I love nutrition. I take supplements. I recommend supplements. As you know, I have an online dispensary, 20% off everything every day for you, my viewer. Link in the video description, but I would never pressure a person or make it a requirement of their treatment, which some people do. I had that done to me a number of years ago. It was a whole treatment that we did. He adjusted me. He worked this muscle, blah, blah, blah. And then he said I needed to buy this homeopathic remedy or my adjustment wouldn't hold. And I said, I don't want to buy that. And he said, well, then I can't guarantee you any results. And I was like, well, I didn't ask you for a guarantee. Whatever. I don't like that. It turns me off as a provider and as a patient. That's a red flag. Treatment sessions are super quick. They want you in and out. Your time with the provider is a few minutes, if at all. There's no time for questions. You don't get to know this person. They don't get to know you. To me, that is a red flag. Time to maybe try a different office. So it may take you some time, some trial and error. I would hope that Googling the right terms and evaluating the websites along those lines will help you avoid some of these negative things that I'm describing. I've already talked a little longer than I planned. This is Dr. Russ. Thanks for watching. I'll see you next time.